In more news tonight, President John Mahama has launched the Ghana Medical Trust Fund, a flagship healthcare initiative aimed at reducing the cost of treating chronic illnesses. Otherwise known as Mahama Cares, it will provide financial support for persons suffering from chronic diseases like kidney failure, cancer, and heart conditions.
It was a campaign promise made at Bodom in the Bono East region by President Mahama on November 12, 2024. The initiative intends to ensure fairness in healthcare access, particularly for those facing financial barriers to treatment across the country. In Ghana, available data shows that non-communicable diseases are responsible for approximately 40% of all deaths. Government believes most of these deaths could be averted with the initiative in force. The main source of funding for the trust fund is the uncapped NHIS, while direct budgetary allocations, donations and grants is also expected to complement its sustainability. President Mahama during the launch noted that a draft bill on the policy document is expected to be laid before Parliament when the House resumes.
Today we're launching more than just an initiative. We're launching hope. Hope for thousands of Ghanaians living with chronic diseases. Support from the fund will be based on formal applications, carefully vetted, and will focus on costs not currently covered under the NHIS. The fund will operate as an independent statutory trust, governed by a board of trustees, and supported by a dedicated administrative secretariat.
He further encouraged corporate bodies and individuals to donate into the fund. As a first step, he promised to give out 6 months of his salary as seed capital.
And so that should encourage all of us and encourage, the corporate institutions to do even much better. But on that note, I'm not yet being paid. They say Accountant General is still doing something. But whenever Accountant General finishes, 6 months of whatever I'm entitled to will go into Mahama Cares.
Health Minister Kwabena Minta Akando has been explaining the modalities and who qualifies as beneficiary.
Once you are a Ghanaian, you are a prospective beneficiary. There will be a number of factors depending on the budget we have. I mean, your occupation, the level of salary. I mean, you put a lot of factors into place.
Rector of the Ghana College of Physicians and Surgeons, Professor Richard Adano, would want government to support the training of more specialists to bridge the gap in treatment of chronic diseases across the country.
And we've realized that we need about 6,500 additional specialists for us to be, of all categories, for us to be able to deliver the kind of care that is needed by 2030. Currently, we have about 2,000 specialists in training in the country. So there's quite a bit of a gap.
Madam Janet Ashigui and her 12-year-old daughter see the initiative as a relief when implementation begins. She and her daughter are battling diabetes for years.
More the more no because a drone tono no body
also be beneficiaries of the initiative are equally elated.
I think that this brings some kind of hope. For so many years, this is something that we've been praying for. But still, we are pleading with the government to do more, especially with the cost of medications for renal patients.